class, we'll learn about myopia. Myopia is very common among young people and shows an increasing trend year by year, which has a serious impact on life, working, and learning. Glasses have been called necessity, and myopia rate is more than 90% from college students. Key points. We will talk about definition and classification, etiology, clinical manifestation, and complications, diagnosis and differential diagnosis and treatment. First, definition and classification. When the image of distant objects focus in front of the retina in the unannounced eye, the eye is of myopia, or nearsighted. Classification of myopia. Birefractive components divided into refractive myopia and axial myopia. Refractive myopia. If the refractive elements are more refractive than average, the error is called curvature myopia or refractive myopia. Because the cornea or lens has too much curvature, the eye's refractive power is outside the normal range. Axial myopia. If the eye is longer than average, the error is called axial myopia. Axial length exceeds normal range. Cornea and lens curvature are within normal range. For each additional millimeter of axial length, the eye is approximately 3 diopters more myopic. By degree divided into mild myopia, moderate myopia, and high myopia. The mild myopia is less than -3. High myopia is more than -6. And moderate myopia is -3 to -6. Simple myopia. Distant vision is blurred and nearsightedness is good. In the early stages of nearsightedness, there is often functional of distance vision, squinting when looking at distant objects. Because no or less adjustment is needed for nearsightedness, the collective function is weakened, and it's easy to cause outcoat or extropia. The degree of myopia is generally within -6. Most patients have no physical changes in the fundus and can be corrected to normal with appropriate lenses. Pathological myopia. Myopia usually exceeded -6. In addition to poor distance vision, it's usually accompanied by symptoms of poor night vision, flying muscles, floating objects, astigmatism, and other symptoms. Dilation, forming scleral edema, a series of pathological changes will also occur in the eye tissue, such as lambda-shaped fundus, lateral cracks, fungus spots, and letter-like degeneration around the retina, subretinal neurovascularization, and etc. Etiology. Etiology of myopia is very complicated. It includes environmental factors, genetic factors, eye habits, and other factors. Clinical manifestations. Visual impairment. Long-distance vision is blurred. Visual fatigue, squinting when looking at distant objects. Eyeball producing. Axial is longer than normal. Refractive examination. Myopic refractive state. Complication. Extropia, posterior stigma, PVD and macular lecture bleeding, retinal detachment. There are 4 pictures. Lambda-shaped fundus, horseshoe cracked, macular changes, retina detachment. Diagnosis and differential diagnosis. Pseudomyopia. Myopia caused by the shapes of the ciliary muscles due to excession, contraction is accumulative myopia. When the ciliary muscles pulverize against its epilate, this part of myopia disappears. Treatment. Composition of the refraction system: cornea, aqueous humor, lens, vitreous. Treatment of myopia: non-surgical correction. Spectacle lens and contact lens. Spectacle lens. Spectacle continue to be the safest method of refractive correction. Misunderstanding about wearing spectacle lens. Question number 1. Will the more myopia, the more I wear spectacle lenses? Question number 2. Will the eyes be deformed after wearing spectacle lens for a long time? Question number 3. Will my eyesight be better at an older age? Surgical methods. Keratorefractive surgery. Keratorefractive surgery encompasses a range of methods for changing the curvature of the anterior surface of the eye. Intraocular lenses. Implantation of an intraocular lens has become the preferred method of refractive correction for myopia. Clear lens extraction for myopia. Extraction of non-cataract lens is increasingly advocated for the refractive correction of moderate to high myopia, with reported outcomes comparable to what can be achieved with laser keratorefractive surgery. The operate and post-operate complications of intraocular surgery, particularly in high myopia, need to be borne in mind. Please develop good eye habits and check eyesight regularly. Thinking question. We know that the first eye lens is much thicker than the human eye, and the curvature is too large, so it looks particularly convex. If a mammalian has landed, can she see the distant object on the shore? If not, can you help her solve this problem? Okay, that's all for this lesson. Thank you for your attention.